Hi, everyone. Welcome and thank you for joining us here today. My name is Jeff Garris. I am the Outreach and Partnerships Director here at the Pennsylvania Policy Center. And this is one of the biggest days of the year for us at the Pennsylvania Policy Center because today is what we like to call Budget Day. Today is the day when the governor of Pennsylvania, the first Tuesday of the month, typically that's when it is, delivers an address to a joint session of the General Assembly, both the House and Senate in one room, with the governor laying out his vision for how he would make investments in the services and the agencies that Pennsylvanians count on and rely on and need. It's a big day. It's the start, really, of budget negotiations over the next few weeks. There will be budget hearings in both the House and Senate in their appropriations committees. There will be all kinds of media appearances people will see over the next few weeks and months. But all of this moves us toward the deadline of July 1st for the governor and the General Assembly to enact a balanced budget that funds Pennsylvania's priorities for the fiscal year July 1st through June 30th. We heard a great speech today from Governor Shapiro. We have a number of experts in policy areas, people who are leaders in advocacy efforts in Pennsylvania on a whole host of issues and priorities and policies that really could make a significant difference for all Pennsylvanians. We're really pleased to have them here today, and we're really pleased to have you here with us. You may have noticed as you joined the room, your lines are muted. If you attempted to unmute it, you would not be able to do that. That's because we have so many people who are here with us today. We have more than 100 folks, probably more, joining us along the way. So in order for you to be able to hear our speakers, we have your lines muted. However, we do want to make this a two-way discussion. We are going to have a time for Q&A. There are going to be some questions that our moderator will be presenting to the panelists. I'll be introducing our moderator here in just a moment. And then we will be taking questions from you. If you have a question about something in particular, maybe in particular for a specific panelist that you'll be hearing from today, please drop that in the meeting chat. If you put that in the meeting chat, I will be keeping an eye out for any questions you've got there. I will be compiling those, and we will try to get to as many of those as quickly as possible. That's the plan for the meeting today. We're really glad to have you here. We will be wrapping up by 4 p.m. And again, thank you so much for making the time and for having the interest and the commitment to really want to see the kind of priorities that make Pennsylvania the kind of place that we can all be proud to live in. On that note, I'm going to turn it over to our executive director, who just joined the PA Policy Center team just a little over 2 weeks ago. We are delighted to be getting to know her. I am going to just say right now, I think folks will be delighted and will really enjoy hearing from the person who stepped to the helm of this important work after Mark Steer, our executive director, wrapped up after 10 years of service. Our director, who I am pleased to introduce today, is Felicity Williams. Felicity, take it away.
Thank you, Jeff. And thank you all for joining us so quickly after the governor's budget address. As Jeff said, my name is Felicity Williams, Executive Director of Pennsylvania Policy Center. Our goal this afternoon is to help translate what we just heard into what it means for people and communities across Pennsylvania, and to name what is at stake as the budget process moves from proposal to negotiation. A state budget is not just a financial document, it reflects our shared priorities and our collective choices. It tells us who we are willing to invest in, who we ask to shoulder the burden, and whether we are preparing for the future or managing short-term crises. I also want to note that we are gathering during Black History Month. This is a time to reflect not only on the contributions of Black Pennsylvanians, but on the policies and public investments that have historically shaped opportunity, access, and outcomes. Budgets are one of the most powerful tools government has to either reinforce inequities or begin to repair them, which makes this conversation particularly timely. As we listen today, we are grounding ourselves in a few core questions. Does this budget move us closer to adequacy and equity in public education as required by Pennsylvania's Constitution? Does it treat public transit as essential infrastructure for workers, students, seniors, and regional economies? Does it protect access to healthcare, especially for people who rely on Medicaid as federal policy shifts increased pressure on states? And does it seriously address how we raise the revenue needed to fund what Pennsylvanians rely on, rather than continuing to defer hard choices? As Jeff said, we're going to spend our hour together this afternoon. First, I'll ask each panelist for a quick one-word reaction to what we just heard. Then we'll move issue by issue through public transit, education, childcare, health equity, and revenue to talk about what this proposal means and what comes next as negotiations begin. As a reminder, we also want to hear from you, so please start to drop your questions in the chat, which Jeff will be monitoring and organizing for us. And finally, we'll close with clear ways to stay engaged and take action in the weeks ahead. All right, let's start with that quick lightning round to capture initial reactions. For each of you, of our panelists, one word that captures your reaction to the governor's budget address and one sentence on why. Connor, I'm going to start with you.
Tepid. I think our governor is not meeting the moment with meaningful new investments in the people of Pennsylvania.
Thank you, Connor. Kicking us off strong here. Susan.
For education, I would say two words, very good. The proposal allocates over $500 million in new adequacy funding to the 363 school districts that are in most need of additional federal aid and takes us another step closer to having a constitutional school funding system in Pennsylvania.
Thank you. We're going to dig into that more. Dr. Pettigrew. You are on mute, Dr. Pettigrew.
Sorry.
Oh, there you go.
So good afternoon. My word is legacy, because everything that the governor talked about today has to be directed toward building legacy. I say political determinants of health ultimately results in the social determinants of life. And making decisions, or good decisions and investments around budget is so important for us to establish long-term legacy.
Thank you. And Mary, I apologize. I skipped over you there for a second, but go ahead. You're up next.
That's okay. Mixed. It's a mixed bag. There's some good suggestions, investments for childcare, for Head Start and pre-K counts. Not so much for childcare. And we all would love the minimum wage increased, but we haven't seen that happening yet. And so it's the beginning, but that's it.
Thank you. And Laura, your one-word reaction and why?
I would say still short-sighted, and that would be because we are still relying on a rainy day fund, and the big changes that are needed for revenue generation in the state are still not there.
All right. Thank you for those rapid one-word reactions. Now let's slow it down and dig into the substance, starting with public transit and what this budget means for people's ability to get to work, school, healthcare, and daily life across Pennsylvania. Connor, I'm going to turn to you next. You started off kicking us off with our word here, one-word reaction. But what stood out to you most in the governor's proposal as it relates to public transit funding?
Thank you so much, Felicity, and thank you so much to all of the folks at Penn Policy and Pennsylvanians Together for gathering us here to realize that our struggles are intertwined. With regard to transit funding specifically, it is extraordinarily disappointing that we continue to hear about transit as if it is something that only affects Philadelphia and a little bit of Pittsburgh. The specific proposal that the governor did not articulate in his remarks, but did articulate on the budget website, is the same failed solution that he's proposed the last 3 years, which did not succeed, which is adjusting the sales tax allocation and assuming that that will solve any problems. The sales tax allocation does not meet the structural deficit facing a single one of Pennsylvania's public transportation systems. It gets closest to meeting that mark in Philadelphia, a place where there is perhaps appetite to do sort of local source funding, if that option were made available to us, of course, because like so many issues, we are faced with state preemption that prevents us from raising local dollars for capital or operating expenses for public transportation. But again, for the rest of Pennsylvania, they're left out in the cold. So not only did the governor not meet the moment with the quantity of money, he also did not meet it with the timing that we need. The flexed money that last year saved the SEPTA region, southeastern Pennsylvania, and Pittsburgh Regional Transit from collapse was flexing capital dollars. So explicitly leveraging our future safety and accessibility of our systems in order for short-term operating gains, and it gave them 2 years. What about the rest of Pennsylvania? We are in a situation where every single transit agency in Pennsylvania has less service than it did before COVID. And we know that these things don't rise and fall in lockstep. It's the same with educational attainment, right? A few million more dollars is not going to produce, real numbers in new students, meeting grade level activities, or a few million more dollars is not going in healthcare is not going to mean that we're going to see life expectancy, rise rapidly. It takes a bigger investment, and then ridership will shoot up from there. But these sort of tepid investments that maintain the status quo do not really have a return. And so, again, for the rest of Pennsylvania, we are aware of at least 7 systems that operate fixed route transportation who will face service cuts and fare increases in the next 12 months. Last week, the first one of those happened. Lanta, serving Lehigh and Northampton counties, so the Allentown, Bethlehem, and Easton region. And so they already are going to have service cuts and fare increases in 2026. Then we're going to hit about a dozen counties in central Pennsylvania. And then by January, it's going to be in Lancaster County, Berks County, Washington County, Monroe County. So many places are going to face service cuts and fare increases. And these are places where, though they do not have the volume in terms of trips, it is just as essential for folks to get to work, to get to doctor's appointments, to get to healthcare, to get access to the outdoors. In the Lanta region, their public transportation system is crucial to their ability to run Music Fest, which is their largest event of the year in the region. So this is something that connects us to, transit is something that connects us to our full selves. It really drives so many aspects of our economy and way of life. So I'll wrap it up just by saying that we continue to not acknowledge the need for mobility and access in all 67 counties in Pennsylvania. And the last thing actually is that our shared ride and paratransit systems, i.e. the transit that is existent in even the most rural place, so for our elders and folks with disabilities, it is facing a structural deficit of $70 million as of last year, but that grows every year. And no one has yet named that. When I talk to our legislators, they are actively told, oh, we hear from paratransit riders that it's, difficult to use or there's problems. But no one's ever talked to us about it being a structural problem with the way that we fund it and the way that we resource it. And so that's causing our small transit agencies, like in Lancaster County, to take millions of dollars that they could be using on fixed route service and plugging holes in that federally required bare minimum ADA service. So we're in crisis and we need investment.
So Connor, if I can, I think I know your answer to this question really quickly. Compared to last year, is this progress, status quo, or regression?
I think the governor would say it's status quo, but in reality, it's regression. And that's saying something when even the governor would say it's status quo and not progression.
Thank you, Connor. Well, you mentioned the connectivity related to public transit. Public transit certainly connects people to opportunity, but education does the same. Susan, let's turn to school funding. What did you hear today about adequacy funding and other education investments that matters most for students and districts?
Yep. So thank you for having me here and for hosting this today. I'm going to start with what's really positive in the budget in terms of K-12 funding. We are just very grateful for the proposal that includes another installment of adequacy funding. I think everybody on this call probably knows in 2023, Commonwealth Court declared our school funding system unconstitutional. The state legislature, for the first time in the history of Pennsylvania, adopted adequacy targets and said we can recognize that some school districts are spending enough to provide students with the education they need. Other school districts aren't. And these students are being very, very much shortchanged by a state funding system that has, over the years, pretty much intentionally shortchanged them. So the state set adequacy targets with a bipartisan vote for 2 years in a row, they have made installments in funding to close what in the beginning was about a $4.5 billion adequacy gap. So Governor Shapiro proposed a $565 million investment that would be directed toward 363 school districts that have that adequacy gap. That is wonderful. And that really is a very, very good thing for students in those school districts. I think we have to temper that with the fact that the investments that are proposed for basic education and special education funding that would be shared among all 500 school districts. So the districts that don't get adequacy funding, we're only seeing a $50 million proposal for basic education funding and a $50 million proposal for special education funding. Those investments do not allow school districts to even begin to keep up with inflation. So while there are districts that have been historically very shortchanged and they are going to be able to start to build up, those districts too are not getting enough funding through basic and special education to keep up with inflation, which means their adequacy funding is going to also have to be spent on keeping up with inflation and the increased health insurance costs. So this is, this is a gigantic investment in children, and we are very, very grateful for it. But I think we do have to just acknowledge the reality that this is going to be really inadequate for a lot of school districts that are going to be forced to think about how to raise this revenue at the local level or figure out what else to do with their budgets to be able to balance them in June. And I just also want to say, deeply appreciate Governor Shapiro's commitment to having a system of funding our cyber charter schools, which educate kids at home, to funding them in a way that the funding matches what it actually costs them, so that we are not wasting hundreds of millions of dollars a year on advertising and promotion and buildings and all those things. So he has proposed another $75 million adjustment to the tuition that school districts will pay to offer $75 million in relief to school districts through reduced tuition rates that will start to, again, get the system in line with where it needs to be and offer a total of, over the past 2 years, $250 million in savings to school districts. So that is very, very welcome.
Thank you, Susan. And then quickly, given the remaining gap, what must our legislature do next to meet this constitutional obligation?
I think I have to say we need new revenue in this budget so that the legislature can come together, they can fill this adequacy gap more quickly, and they can make sure that we're not creating a new set of districts that are impoverished because they are not getting the state funding that they need by having at least state funding keep up with inflation. So I'm here to say we need new revenue also.
Penn Policy Center is here to say that too. So double click, ditto, all hands down on that one. All right, thank you, Susan. Education, however, isn't limited to just K through 12. Childcare and early learning are just as critical. Mary, let's bring you into the conversation. So you had a mixed reaction to the governor's proposal.
I have a mixed reaction because, first of all, I want to thank the governor for last year's budget for implementing and instituting the recruitment and retention grants that were historic in our state. And it's a recognition that we really do need to support the workforce of the ECE field. Pennsylvania does not work without childcare. Childcare does not work without the staff. And we cannot continue to pay people significantly less than they can make by working at fast food places or restaurants or convenience stores. Not that that is not hard work, but our staff need to be compensated for their qualifications. We believe in high quality. It is not babysitting, it is education. Childcare is not just for parents, it's for children. So it needs to be a combination. It needs to be accessible to families. It needs to be sustainable to the owners. I work at a nonprofit, but no childcare program is profitable. Childcare employees often cover things on the back of their staff. We love that this governor is keep proposing for raising the minimum wage, but raising the minimum wage without raising the dollars for childcare will just put it harder on the childcare employers. We are really appreciative that he started the retention and recruitment grants last year and increased them by 50% for this year. However, people are not going to come to this field because they can get another $650 a year. It's a much more complex issue. But we do appreciate that this is a governor who has kept his word about childcare. We are also glad, as usual, that they've increased funding for Head Start, state supplemental Head Start, and pre-K counts. But again, pre-K counts and Head Start are not childcare. They're part of the puzzle. So we need to look at this more holistically. It needs to be a systemic change. There are so many things that other states are able to do that Pennsylvania could be a champion and do it. So we thank him for what he's done. We appreciate the proposals. We appreciate that putting $10 million, additional $10 million in the retention and recruitment. We have a way to go. So that's why it's mixed. It's a beginning. We hope that the systems can be such that families who are, we're glad that people in Pennsylvania are making more money, but that means they lose childcare. And families who lose subsidy for childcare cannot afford the private cost of childcare. This is a labor-intensive field. In Pennsylvania, in Philadelphia, here we're a high-quality childcare center. Children's Village is a star 4. We get the highest reimbursement rate. But what we get for a preschooler per hour, we get $58 a day. Children are in care 10 hours a day. That's $580 an hour reimbursement. You can't park a car in Philadelphia for $580. People don't look at the numbers. Yes, it's an expensive commodity, but it's a needed commodity. And we know that high quality ECE affects children for life. It affects what schools have to pay for when children go to kindergarten. If they're not ready, it's going to cost us much more. So we really see that this is a critical issue. We want to make sure that families who are making better wages can stay on childcare. We want the state not to do a market rate survey, which is an artificial review of what childcare costs are, but what a real cost of care is. We want people to be able to budget for what it costs and not say, okay, here's $10,000 to deliver the service. So, I appreciate what this governor has done. He's been empathetic. He's been responsive. He understands that people really want to make more money, but it has to go hand in hand. So raising the minimum wage means raising more childcare subsidy.
Absolutely. Thank you, Mary, for talking about how we need to approach this holistically, that childcare is education, that it is not just for the parents, it's for the children as well. And when we don't invest in early learning and childcare, we just bear the costs further down the line and defer that. So thank you for that.
You're welcome.
Childcare, education, transit, and health outcomes are all deeply connected. Bringing it over to you, Dr. Pettigrew, let's talk about health equity.
Oh, absolutely. As I listen to the governor talk about energy and safety and housing and welfare and childcare and data, et cetera, and I could only think about the fact that health is wealth, and that if we don't deal with the issue of making sure that we're taking care of both those people who are living in poverty and those people who are not, because when we talk about health equity, we're not just talking about the poor young girl who has a baby at home just to take care. We're talking about women who live in the suburbs who are experiencing domestic violence. We're talking about health equity across the landscape of living a really positive life. And so I was disappointed because he did call out the fact that we have so many hospitals that are closing, especially those in the rural areas, and we have to address that. And the fact that we have so many changes in our Medicare, Medicaid, and as well as our CHIP that's going to occur. And as we move into this big, beautiful bill, we're going to have we got headwinds coming that are going to be pushing a lot of what he has proposed to help with these situations. Back to, I hope you're not too far back, but I was excited about the fact that he wants to invest boldly. To talk about, first of all, we're dipping into our kitty right now in order to make sure we can keep this budget going. But what happens long term? What happens with sustainability? To invest boldly in healthcare means that we have to think about sustainability in systemic change and political change, because both of those together are necessary to narrow the health and the wealth gap that many of our constituents are facing. I didn't hear much focus on, community-centered strategies around, where are people right now? I mean, people who are struggling just to get to work. We talked about transportation. We talked about, all of those things that are required to have someone who can get to work in a healthy way. But I didn't see him address many of the issues that I'm really concerned about related to changes in Medicare, Medicaid, and changes such as in his plan, he plans to decrease the coverage for GLP-1s, um, for instance, right, for obesity. So that comes up as an issue. But if we think about one of the major causes of morbidities in Pennsylvania, across the country, across the world, we need to deal with the real fact that obesity is a major contributor to cardiovascular disease, to diabetes, et cetera, et cetera. So when we talk about, taking one thing away and putting something else in its place, we're doing nothing at all. We're just doing that, replacing one thing with another. We're not making those significant sustainable changes that's going to make a difference in the lives of many, many people. He talked about the fact that people are now already decreased their medical coverage because they can't afford it. So by 2034, which is not that far off as far as I'm concerned, 500,000 of Pennsylvanians are not going to be insured. And that's that is a guesstimation. And so we have not put in place by this budget and moving forward to really deal with the sustainable issues, the issues of really tackling the political and systemic changes that have to occur long term to narrow that wealth gap, which then will narrow our health gap. We talk about workforce and yes, but if you have poverty and you're just talking about increasing the minimum wage, those people are still in poverty. So it's this getting on this merry-go-round, which doesn't make significant change. So I think that there's lots of hope in what he discussed today. I'm sure there's going to be some very positive outcomes that we are going to be able to measure. But I think when we really dig deep to really make significant changes that are going to be sustainable as we go into the next budget and the next budget, we have to be very serious about what we're doing to narrow that health gap by dealing with the wealth gap.
Absolutely.
I'm going to stop there because I could go on and on. But so
you all are all so passionate. I appreciate it. You are spitting the facts here to everybody. You are breaking it down. Thank you guys so much for doing that. And thank you, Dr. Pettigrew, for making the connection between what happens at the federal level impacting us here at the state level as well, and making that connection between health and wealth. But I have heard a common theme among all of you. All of this brings us back to the core question of how Pennsylvania pays for what people need. I heard you guys say repeatedly about sustainability or new revenues. Laura, let's close this section with a discussion about revenue. What did the governor signal today about revenue and the Commonwealth's fiscal outlook? And what are the consequences if we continue to delay fair share revenue solutions?
Okay, so I would like to start by just pointing out the numbers, and from there we can draw the narrative. So our budget is, or the proposed budget is currently sitting at 53.3 billion for this fiscal year. That's an increase of about 2.7 billion compared to last year. All good as of now. To make this work, we have that the rainy day fund is actually 4.6 billion are being transferred from the rainy day fund. And that is going to leave our rainy day fund with a cushion of 3.3 billion. Now, while the governor did mention that this was, that we did have a healthy rainy day fund and we had safe balances, one would argue that's not the case when we look at the long-term outlook for the state. However, this budget does have some small changes and some changes that actually we at PPC have advocated for. One of them is that switch from Water's Edge reporting compared to the single payer reporting, which hopefully in the long term is going to bring additional revenues to the state. We also saw the two proposals, the two big tax proposals, which were taxing and regulating skill games, which we all know has been a big issue for the state in the past couple of years, as they've appeared basically everywhere. And second, we have the potential legalization of marijuana and taxation for it, which it's going to be budget says it's roughly going to start applying January 1st of 2027. So taking all of this into account, we have had small wins in this legislative cycle in terms of the budget proposal, but none of these are going to help us address the roughly $8 billion deficit in the long term. And in particularly, how are we in future years going to recover that $4 or $5 billion that get pulled from our rainy day fund every year? ARPA funds are expired, they're appropriated, we're not going to get them anymore. And as we're being faced with this federal cuts, we are going to imagine the situation is going to get harder, not easier. So while the budget, doesn't do anything crazy in terms of lowering taxes, although the governor did make a comment about that in his speech. We do see that they're not enough, that we need actually revenue generation from those who are not paying their fair share tax. We have a small step forward with the Water's Edge combined reporting, but that is not enough to take us where we have to be.
And Laura, let me ask you this, because you spoke to the fact that we have a deficit. But it's not just about the fact that we have a deficit with our tax system, right? It's about who is paying taxes and who is paying more than their fair share of the taxes and who's paying less. We know that Pennsylvania has more millionaires and billionaires than Massachusetts and Washington, D.C., but yet they are paying less in taxes. Talk to us a little bit about the inequity in our tax system.
Yes. So we're one of the few states that still have the uniformity clause, which basically means we're still stuck with that 3.07 personal income tax. We do not have graduated levels for those who are making more and thus can contribute more. They say this is a proportional tax, but the truth is it affects those who are low income and working families the most. Because while a billionaire might not care if they're paying $1,000 or $2,000 additional for a family making $25,000 or $30,000 a year, that's a significant portion of their income. Mm-hmm. And then at the corporate level, we still are dealing with the Delaware loophole. Other states, roughly 20 to 25 states, have already taken active action to resolve it. They have adopted Water's Edge reporting. Our main proposal, which is worldwide combined reporting, is not there yet, partially because of regulatory and administrative burdens that would need to be resolved beforehand. But we have that big corporations such as Target and Walmart actually pay $0 in corporate taxes. So while we can hope that this change in the proposed budget to move towards a Water's Edge reporting will solve those issues, the truth is we can't just have one solution. We need multiple solutions to make sure those who are millionaires and billionaires are contributing their fair share.
Absolutely. Thank you, Laura. And thank you to our panelists for joining us in that round of issue-based discussion and bringing clarity to a complex moment. As we move forward here, we've covered a lot of ground. We want to turn to your questions and give our panelists an opportunity to answer some of those. Jeff has been monitoring the chat, and will surface a few for us to discuss here. Jeff, what do we got?
Thanks so much, Felicity. Yes, well, we're getting a lot of questions on a range of different topics in the chat. I'm going to go to as many of these as we can. Some of them I think are fairly specific, which panelists we're going to, but some of the others I think are more open so we could hear. Again, panelists, if you can kind of keep an answer to a concise 30 seconds, if you want to follow up with somebody later, that's great too. Let's start right off with a question Blake had about, and I'd say this maybe falls into the area of both healthcare and childcare. But Blake's question is, any mention of paid family leave, specifically the Family Care Act? Any of our panelists want to take that? Mary?
I didn't hear anything. I would love paid family leave. We know that this is a situation that Pennsylvania must move forward on. We have to support working families, and it can't just be 12 weeks of unpaid leave. We have to make it a beneficial leave. Infant care is extremely expensive. Many other industrial countries have done away with infant care by having paid family leave, and children start off better. We know that's not always possible in every country, in every state, and some families need to work. So we do need to move forward on paid family leave, not just for the workers in the, the families that are being served, but for the childcare staff. They don't even have paid family leave.
There was no mention, I can tell you. I listened very carefully. There was no mention. But I agree with you, Mary.
Thank you for that, Dr. Larkins Pettigrew, and also Mary, and thank you for the question. We have another question related to childcare, so I'm going to go back to you again, Mary. Alyssa would love additional information about how other states address childcare funding.
Well, it's interesting. Every state does it differently, but a number of them use the cost modeling as opposed to a market rate survey, meaning we actually find out what it costs, as opposed to just having people answer an outdated survey about saying how much you charge families. And they're looking at the real cost of care. If you walk into a car dealer and say, I will give you $25,000, give me a brand new car, you will walk out with a car without any wheels, or maybe without an engine. But that's what childcare employees and childcare facilities are requested to do by providing a service without full funding. In Washington, D.C., they tax the more rich and pay people individually. And each state does it differently. Pennsylvania is novel in that there's the retention and recruitment award goes directly to the employee, which is important. It doesn't go to the childcare owner. It goes to the employee, and that's how many other states have done it. We all would love universal childcare. We're not even anywhere near that yet in Pennsylvania. One thing that I would love Pennsylvania to do, and which 12 other states have already done, is that they make the childcare employees eligible. We happen to pay sometimes better than other childcare providers, but that means I can have staff who can't send their own children to Children's Village, which doesn't make sense.
Yeah, that's just shocking to realize, the folks who are providing the services cannot actually access those services because
Correct.
they're so expensive.
Correct.
Another interesting question here comes from one of our friends in sort of north central Pennsylvania, Kristen, who is curious about Dr. Larkins Pettigrew's reaction to the governor's proposals on health and care investments targeted to the elderly.
Well, we know that we are a significantly aging state, and that the investing in our aging population in order to give them the opportunity to stay at home, to live lively lives is important. He talked about the fact that there's going to be an algorithm that they're going to be using with the AARP to make sure that they're held accountable for some of the things that they're offering through AARP. He also talked about protecting the aged from many of the scams that are going on across the country. But significantly, we see a lot of it happening, of course, in our own state. I think that knowing that this population, and I'm in that population as well. This is the population of wisdom, and we have to make sure that we appreciate and take care of our aging population. And I was excited that they're investing. I want to see exactly what that means, and what some of the outcomes will be. But I think that was a great move by the governor to talk about that.
Thank you for your question, Kristen, and thanks so much for your answer, Dr. Larkins Pettigrew. Going to go on to education here. I'm going to say this is education because I think it kind of is related, and could probably get some answers from Susan, maybe some others. But Nan, our friend, would like to know how library funding looks for the next year. We're talking about public libraries. Susan, I don't know if you have any thoughts on that, or anybody from the Penn policy team who might have that. I wasn't quite sure who to go to for this.
I don't know, but I can take a quick look at that spreadsheet and see if I find something and put it in the chat.
Thanks so much, Susan. That would be fantastic. Also want to note for folks, Susan did drop in the chat there some information about something that the organization that she leads, which is Education Voters of Pennsylvania, is holding coming up on February 10th at 7 p.m. It's going to be a real deep dive into the education funding proposal, and she dropped the link in there for Mobilize. So I would encourage folks to want to learn more about education funding to attend that. Susan, I don't know if you wanted to comment on that at all, or add to that.
Yep, every year we do a deep dive, so if you really want to understand it, and then we'll have spreadsheets with what the funding looks like for each school district, and then we can kind of talk about advocacy work that you can do and what you might want to be able to lift up and who to talk to try to get this funding through for your school district. So it's a good event. And as I'm looking, I looked for library funding, and I see public library subsidy flat funded, library services for the visually impaired and disabled flat funded, library access funding is flat funded, and the state library is flat funded. That's all I have.
Wow. Yeah. And as we all know, when we've got rising costs and challenges with affordability, flat funding is actually a cut. And for something as important as libraries. Thanks so much, Susan, for being such a good sport and pulling that up so quickly. I'm going to go on to some other questions on some other topics here. I'm keeping an eye on the time. Again, if you have a question, drop it in the chat. Our friend Coleman here in my community in Philadelphia would like to know, is the severance tax completely off the table? Severance tax would be a fee that would be imposed on natural gas drilling in Pennsylvania. I'm going to go to Laura on our team. Laura monitors a lot of this, and I know Laura was responding in the chat. What about the severance tax, Laura?
So as you might remember, in our last budget, we left RGGI, the Regional Greenhouse Gas Initiative. So Governor Shapiro did propose a similar voucher or like tax credit trading system for pollution. So because of that, we're still not super sure where the environmental regulations are going. What is unlikely to happen is that we're going to end up with the cap and trade system proposed to replace RGGI plus a severance tax. So I guess we're just going to have to tune in to the next budget and see.
Well, thank you so much for that question, Coleman, and Laura also for addressing that. Another topic related to energy issues, question from Erica, who would like to know, what executive powers does the governor or lieutenant governor have to speed up some money-saving initiatives like electric bills? Again, I don't know that we have anybody specific on the team, but or of our panelists, but I don't know if Laura or anybody else from Penn Policy might want to take a stab at that.
Yes. So one of the measures that the governor did mention during his speech was the fact that whichever corporations that were going to be contracted to operate in Pennsylvania for data centers and related technologies would have to assume their electric costs, hopefully in the long term decreasing those for regulation for citizens. In addition to this, at the local level, in terms of municipality and township codes, there is a lot municipalities can do to regulate these data centers. And I believe there are already some bills going in through the legislation that would attempt to regulate all of these different legislations and all of these different tax codes so that there is a clear understanding of what can be done at the local level.
Thanks so much, Laura. Yeah, really a critical issue, particularly as costs continue to rise. Another cost related to housing is a question from Art. Art says, and Art from Northwest PA wants to know, what about the new housing plan? If we don't have a housing plan, we will lose population and hence tax revenue. Did anybody hear anything about housing policy today or what we might need to do about it? And I'll open it to any of our panelists. Doctor, you want to go ahead?
I can only comment on what I heard, and I thought
Sure.
it was very positive about investing $1 million into new housing and to really control how people can afford the housing so I thought that was a great idea, and I don't know no details, but it is an investment in housing because most of our young folks think that that's just it's not affordable to even buy today. So he did cover some things about housing and investing in housing. And I think it was like was it $1 million?
Yeah.
1 million? Yeah.
I would just piggyback on that and say, great to hear about investing in housing and affordable housing. I mean, as Dr. Pettigrew said, we know that rising housing costs is a major issue, not just for Pennsylvanians, but folks across the country. I think it comes down to a question again of where is that $1 billion coming from? How are we generating sustainable long-term revenue to invest in the things that Pennsylvanians, particularly our working families who are feeling the squeeze in a number of areas, really need? And that's still a question. We need more details. We need to understand exactly what that means. Of course, we want to support increasing housing. We want to do that, though, also without gentrification. So we would have to look at how the two work together.
And I'll actually add here that this is really closely tied to the success of our transit systems. There are some really good bills in our state legislature right now related to transit-oriented development that need to be amended to include areas that are not using rail-based transit, because that's just not, the full picture of public transportation in Pennsylvania, and in fact is harmful to the the cause when we don't acknowledge that. So adding it to high frequency bus routes, adding it to major Amtrak stations like in Lancaster, being able to build around these facilities will mean that we will have more revenue for our transit agencies a lot of times if it's on their land. It'll be more ridership, which means more stable finances. And it means that it'll fix our affordable housing problem, right? And build more livable, walkable communities that affects our social determinants of health.
Thanks so much to our panelists and Felicity for chiming in on that. That was one we didn't have somebody specifically assigned to, but everyone is very knowledgeable about that, and glad to have that input and information. I'm going to go to a question here. It's sort of a comment, another healthcare related question. This is from Alyssa. This is for Dr. Larkins Pettigrew. Alyssa notes that her monthly cost for healthcare is 6 times more expensive now. And Alyssa is concerned about how healthcare is going to lead to increased poverty levels in Pennsylvania since we rely so heavily on penny subsidies. Any thoughts on that?
Well, that's absolutely a concern, and it's we see it happening already. And so he did talk about subsidizing not only Medicare and Medicaid, but also he talked about subsidizing some of the hospital systems so they can afford to cover many more of the services that need to be covered. At the end of the day, if we don't fix this broken system that we have, which people don't want to say out loud, but we have a broken healthcare system that has not dealt with the whole issue of taking care of everybody in a very health equitable way. It is much more complicated than any of us could even imagine. But yes, and I can see that not only are you in this situation, but there's so many others that's going to continue to be added to that role, because I don't think it's going to get much better. We don't have the funds to support everyone. And I know the optimism is there, but we have to make sure that we strategically look at how we're going to take care of all of those individuals that are affected by the changes in the healthcare system and coverage.
No, yeah.
I want to add to that, unrelated, it seems, how it added costs to the cost of childcare. So
Yes.
at our center, we provide healthcare for our staff and their dependents. And this year, I had another 25% of our staff needing healthcare because they were dropped by the network. We are legally responsible for providing it. We had a deficit for the first time in 30 years. And I cannot turn down staff for needing healthcare, especially when they're working with young children who come to school ill. So I need staff covered by healthcare. So even though it's not a direct cost increase, the loss of healthcare for the effect on Children's Village, it has increased the cost of childcare significantly.
Yeah, really important point there. Really gets to the ways that all of these issues are very interrelated, and that what we do in one area affects a lot of other things as well. A follow-up question related to healthcare and the cost of medical treatment and medical insurance comes from Nan. I'm going to go again to the doctor with the question: how will the state pay for their share of the new SNAP error rate policy?
He did talk a little bit about that, but we are looking for revenue, looking for funds. How are we going to pay for how are we going to pay for it? Because we definitely need to do it. There's no way people are going to afford to live. SNAP has been here for a long time, and we know how critical it is. And so it's one of the things in his proposal. Is I also I'm reading his budget, but where's the money coming from? I agree. That's the question that has to be answered.
Yeah, and as we heard from Laura, there are some ways that we could actually raise that money and pay for a lot of this by making people who are taking a free ride when they've got way more than they need to start doing their fair share. So thank you for addressing that one. Speaking of, some of the costs that we face, we have another question related to education funding. This one comes from Morgan. I'm looking at the time. We've got about time for, I think, one more question here after this, and I've got one in the queue already. But from Morgan, the question is about Governor Shapiro mentioned an adequacy formula that was created together that would save $250 million for public schools. And I was wondering if there was any insight as to how that would work. I'm going to go to you, Susan.
Yep, so there were two different things. There was the adequacy formula, that is new money that's going through a formula to the school districts that have been historically underfunded by the state. And then there were cyber charter savings, an additional $75 million that would be taken off of the tuition that school districts pay to be added to the $178 million from last year. And that would total $250 million that we would just have in reduced education costs. It is like great when government works and you can get efficiencies and you can get you can just call out the waste. And so the cyber savings are $250 million in savings. And then the adequacy formula is for new investments in state funding. And there is $565 million that are going into a new adequacy funding formula to school districts that need it the most.
Thanks so much, Susan. Yeah, that was a really great question about how we're going to pay for these, and there are ways to do it. I mentioned that there was one more question I had in the queue here. This is, again, one that probably crosses a couple of different issue areas. This comes from Cecilia. Cecilia, it's a question, I think, really about disabilities and behavioral health. Cecilia's question is, what did the governor propose for people with disabilities and behavioral health?
The governor did talk about people living with disabilities, and it was more around workforce and how he has really engaged many corporate entities to really consider the hiring of all able bodies, but to really look at the individuals who are living with disabilities who can really contribute to our economy. And that's what I heard. Anybody can make a comment about that as well. And what was the other question? What other group? Or was it just?
It was behavioral health, and I think it was persons with disabilities.
Also money investing in behavioral health. There's a whole, and I guess who's on it? Laura probably could address this because in the budget he talked a lot about substance abuse, behavioral health, investing in mental health, and what figures are those? But definitely that was part of his speech today about investing in those areas as well.
And just a note, the figures for mental health is we did see an increase, roughly a 64 million increase in this fiscal year. So definitely kept up with inflation, probably a little bit more. It crossed the threshold for 1 billion from 938 million.
I'll bump that mobility justice is a huge part of this. And when we talk about the 20% of Pennsylvanians who can't drive, that's what we're talking about here. And so, again, a failure to see transportation as a mobility and a disability issue is grossly short-sighted.
And we also know that the numbers of children with behavioral concerns has increased significantly due to the trauma that low-income children and families are facing, yet the funding for early intervention has not increased as quickly as the numbers of special needs children have increased. And again, it's putting a stress on the childcare system. Supports for children with special needs are not year-round, or are they all day? They're limited in time and they're limited in the calendar. Children still are autistic at 3:30 in the afternoon and during the summers, but services for children on the autism spectrum or children with other disabilities, behavioral health are not served year-round, and that is a problem in our state.
That's a great point to make, Mary. Thanks so much, and a really sobering thought here as we wrap up. I'm going to turn it over to Felicity to kind of close us out here a little bit before I take care of a couple of housekeeping items. Felicity, go right ahead.
Absolutely. Thank you, Jeff. So thank you to our panelists for joining us and bringing clarity to what is certainly a complex moment, and for each of us elevating and recognizing that we have to take the courageous actions to raise additional and new revenues. We absolutely have to be able to provide the things that Pennsylvanians need and Pennsylvanians deserve, particularly as it relates to keeping our Commonwealth affordable, which we heard the governor speak about a lot today. It was a central focus of his address. So thank you also to each of you who took time to be with us today. The governor's budget address marks the beginning of the budget process, not the end. What happens next in negotiations, amendments, and final votes will determine whether Pennsylvania moves towards affordability, equity, and long-term stability, or continues to manage challenges year by year. There are, of course, a few concrete ways to stay engaged. First, stay connected with Pennsylvania Policy Center. Sign up for updates and action alerts so you can track key moments in the budget process and opportunities to weigh in. You can do that. I'm dropping the link in the chat there, pennpolicy.org/sign-up. Second, as it relates to ways in which we can raise those new revenues, in particular, cutting taxes on working families while ensuring that our corporations pay their fair share, and wealthy residents, millionaires and billionaires in Pennsylvania pay their fair share as well. You can join For Our Commonwealth, our statewide campaign focused on addressing the coming fiscal cliff, avoiding cuts, and securing the revenue needed to fund schools, healthcare, transit, and other core services Pennsylvanians rely on. You can visit our campaign page. We're dropping it there in the chat, but pennpolicy.org/pat-4-r-common-wealth. This page is the central hub for that campaign, including background on fiscal challenges facing the Commonwealth, because it is not just a talking point, it is a reality. Detailed information on tax and revenue proposals and ways to engage, whether you're an individual or change maker, part of an organization, or an elected official. Finally, this week, we're launching a 2026-2027 budget webpage that will be populated over the course of budget negotiations with fact sheets, infographics, statements, and tools to help you understand what's in the proposal and advocate for what our communities need. We'll share that with everyone who registered and across our channels as it goes live. Thank you again to our panelists and everyone who joined us today. I'm going to hand it over to Jeff to do our final closeout here, but please make sure you take care and stay engaged, because the future of the Commonwealth depends on what comes next.
Thank you so much, Felicity. Again, thank you to everyone for joining us here today. We're putting some information in. Coming up 2 weeks from this Thursday, we will be doing another meeting pretty similar to this. We do this every third Thursday at 1 p.m. There was a question somebody had about immigration policy. You're going to want to join us for that, because that's what the topic is going to be when we come back 2 weeks from this Thursday. So please sign up now. As I close out, I want to say thank you to our guests, Dr. Larkins Pettigrew. I want to thank Mary, Connor, Laura, Susan for bringing your expertise. Really appreciate it. To my colleague and my friend and my boss, Felicity, thank you so much for helping to moderate this. A couple other folks on the team working behind the scenes, Adrian, Kirsten, and Erica, thank you so much for all the work on the tech side of this. And I also want to say a big thank you to our allies, Jillian from Better Pennsylvania and Dan from Pittsburghers for Public Transit, Transit for All PA, for helping us with the meeting security and keeping the meeting flowing smoothly. Again, thanks so much, everybody. Check out our website over the next few days. We're going to be putting a lot of budget resources there. Take care, everyone. Have a wonderful day.
Thank you.